Is Plan N's lower premium a smart move or a costly mistake when compared to Plan G? Let's go ahead and check it out. Welcome back to Medicare Happy Hour, the most fun you'll have on the internet while learning about Medicare. Today, I am sipping on some Cab Franc, and we are going to be discussing the difference between Medicare Plan G and Medicare Plan N. Cheers. All right, so before we dive into the difference between Plan G and Plan N, I want to give you a brief refresher on Medicare supplements. And, we have multiple different videos about this, so go ahead and check out our page if you want information about a different supplement that I'm not talking about, or Advantage plans versus supplements, etc. So to kind of dive on in, what are Medicare supplement plans? So these are also known as Medigap plans, and they are health insurance plans sold by private insurance companies. Now, they're designed to be paired with original Medicare, so that's your red, white, and blue Medicare card, Part A and Part B. You do need to purchase a Part D drug plan to pair with your Medicare supplement. They're not included. This is just your medical insurance. And there's 10 different types of Medigap plans. They're lettered A through D. There's an F, a G, and a K through N. We got rid of a few in 2010 and added a couple of new ones in. That's why this isn't perfectly alphabetical. Whether they're standardized. So the G and the N plan that I'm going to be talking about today, regardless of which insurance company you enroll with, it's going to be the same G plan and same N plan. So no matter where you live or what insurance company. And just a quick reminder before we dive in, because I'm going to be talking about this in a minute. In 2025, the Part A, so your hospital side of things, the deductible is $1,676. And Part B, your doctor side of things, the deductible is $257. So we'll come back to that in just a minute. All right, so before we dive into Plan G and N, it's a great time to go ahead and take a sip of your cocktail, or in today's version, your red wine. All right, so talking today about Plan G and Plan N. I went through this chart for all of the supplements on a previous video. So if you're curious about this chart with all the supplements, again, go ahead and check out one of those videos. But for today, we're only going to focus on G and N. And you'll see here, these appear to marry each other quite closely. But there are a few things I want to point out. Number one, on both of these plans, you're going to have to pay your Part B deductible. That's that $257 I just mentioned. The good news is that Part A deductible, the really big one, the $1,676, that's covered. This is just your Part B, the $256. That said, there's two other things on the supplement that I do want to point out before we kind of recap with the pro and con. One thing is, first of all, we always look for these asterisks here. So you'll see here, Part B coinsurance. The way that the Plan N is structured is you would pay up to $20 when you go see a doctor for your Part B coinsurance, the doctor side of things. And you would pay up to $50 if you're in the emergency room. Now, if you're admitted, it goes into a hospital stay, it's waived. There's a whole lot there. But that is one factor here that helps to reduce that premium. The other factor, and I'll talk about this in a little bit, is your Part B excess charges. Now, that does not apply to everyone, but let's go ahead and dive into the main pros and cons of these plans. So you'll see here, Plan G. Essentially, this is the most comprehensive coverage you can get. We used to call Plan F the Cadillac, but if you turn 65 after January 1st of 2020, you're no longer eligible to enroll in Plan F. So there's a few reasons why, even if you were eligible for Medicare prior to, even if you were able to enroll in F, that we would maybe recommend you take a look at the G instead. So, it covers your Part B excess charges, those copays. There is a high deductible Plan G available. The monthly premiums are much lower on this plan, but that deductible is $2,800. So that's pretty significant. A lot of times when people start to talk about that plan, they start to just consider Medicare Advantage instead. But, there's a right plan for everyone, and everyone's needs are slightly different. Now, the cons of Plan G are obviously that if it's one of the most comprehensive plans, it's going to be one of the highest premiums. Just is what it is. So now looking at Plan N, the pro is that the lower monthly premium. So what we did is we looked at some general supplements in certain areas, and we kind of averaged it out that you would see around $120 a month for a Plan N. Now, this is around a 65-year-old, and of course it varies depending upon where you live. But we're seeing about $150 per month for a Plan G. So in average, most of the states we checked out, it was between $30 and $50 less a month for that Plan N versus that Plan G. Now, again, the cons are, what do you do with that $30 to $50 you're saving? You're going to go ahead and pay for some of the copays for your doctor's visits, or if you're going to the emergency room. It does not pay Part B excess charges, and this is something I want to talk about real quick. Not every state allows doctors to charge Medicare Part B excess charges. Frankly, some do. And you could receive a bill after your appointment for up to 15% additional to the cost of your appointment. Now, I'll be frank, my father-in-law was on one of these plans for years, and he would get really small bills, under $20, maybe $15, something like that when it came to the excess charges. So he lived in a state where they were allowed to charge excess charges. A lot of states don't even let you. So it truly depends on where you live as well. That's something important I would recommend you keep in mind. And then last, you could face underwriting if you're switching from an N plan to a G plan at a later point. Generally, if you're going from a higher plan like a G down to an N, it's a little bit of a different situation. So just something that I would recommend you keep in mind. So, at the end of the day, neither plan covers your Part D drugs. You're going to have to still purchase that plan. Neither plan covers dental, vision, or hearing. Long-term care, so your nursing home element, your skilled nursing care and rehab, that would be covered the same as any Medicare supplement would cover. And then last, private duty nursing, if you're getting something on your own or having someone come in to help you. Those things are not going to be covered by either of these plans. On the flip side, the similarities are, these are really strong coverages. These are great plans for you. It just depends on your specific needs. You're still going to have to pay your Part B premium regardless of which plan you're on. And you're also going to have to pay your Part B deductible, that $257 I've mentioned a few times. And, at the end of the day, it covers the out-of-pocket max that original Medicare leaves behind. So you're protected, and each option, really, you can't go wrong either way. It sort of depends on which plan works better for your particular situation. All right, so cheers as we wrap up. The one thing I want you to keep in mind as we move forward with this is you can't go wrong with either of these options. Your specific needs will dictate which route you look at, but ultimately at the end of the day, these are really comprehensive plans, and you're going to be in a decent spot with either one of these. When it comes to all of these Medicare plans, your specific situation is the most important thing to keep in mind, not what your neighbor or even your spouse did. So at the end of the day, if you have a question, give us a call. We're here to help. This is all we do, and we're happy to help.